They're normally symmetrical because the blood inside our body goes to the right side, the same as the left side. Our medicine is not a medicine that can do anything harmful to your body.
Dr. Ray Nettles is redefining hair and hormone health with data-driven precision, transforming patients through custom biochemical insights. Get ready for a conversation about real results and lasting health.
Welcome back to Q&A with Dr. Ray.
Hello, Tracy. Good to see you for the Q&A with Dr. Ray.
Good to see you too, Doctor. So what have you got to talk to us about today?
Okay, Tracy, I think today we're going to review hair patterns. So we're going to be looking at images of hair, specifically the 5 zones of hair loss. And we're going to discern between the really 2 types of hair loss. And the 2 types of hair loss are genetic, which is inside a gene inside the DNA causing a defect to the enzymes controlling the hormones. And the other type is immune related. So we're looking at either genetic hair loss or immune related hair loss. And we're going to show you the patterns, the differences between the patterns. So we'll contrast and compare a couple of images so that everyone have an idea of the types of hair loss and the patterns that are associated with the types of hair loss. And sometimes we can discern and diagnose the hair loss pattern and prescribe the topical as opposed to getting the blood work to use an oral supplement to treat a blood-related disorder such as the genetic. So if this is simply an immune type of hair loss, it can be treated topically with the specific ingredients inside the topical at that time. So we have patients that will come and see us, and after the part 1 assessment of the hair pattern, we can go ahead and start the topical treatment. And if we don't have evidence of the genetic hair loss patterns, we do not have to move forward with the blood work. I guess not the problem, but most of the time we see a combination. So we're going to see a photo from a patient that we saw a few months ago in the office. And this patient has a combination of patterns, which is pretty tricky to the unexperienced eye. We're going to do our best to highlight the pattern, and we'll zoom in so others can see what we see. Inside the office, we have a microscope that we use so the patients can see what our team can see.
And then which picture would you like to start with first?
All right, so there are 5 zones, and today, Tracy, let's start with zones 1 versus 3. So a lot of times the zones 1 and 3 are the temples, and a lot of times the guys will see those, and even women will see those start to recede backwards. But they recede backwards in a wall of hair. So the hair doesn't fall out, the hair thins out, okay? So when we think of genetic hair loss in zones 1 and 3, we think of the temples receding, and we think of the hair thinning out, not falling out, okay? So we're going to look at the pictures here, and this is zone 1 on the left and zone 3 on the right. And what we'll do is I'll highlight, so bring your attention to the zone that we're going to be looking at, okay, right here. And then we're going to compare that to the zone on the right side. And the first thing we can see is that there's a lot of thin hairs out front, right? Thin hairs. And then as it goes backwards, we have thicker hair in the back. Is that noticeable to everyone? Hairs are thicker back here and thinner as we move forward. Okay.
Yeah.
All right. So that's the easy part. So is this genetic hair loss? The answer is yes. It's quite obvious because there's a wall of hair that is starting to thin out going backwards. But inside the office, we could tell that there could be more going on. So when there is genetic thinning of hair, there's a wall of hair. And in this situation, it's not quite a wall. As we look inside here, there are areas that look like they're missing follicles. Here on the left, even back here, and all the way back here. So there's not a consistent wall of hair, because in between the hairs that are thinning, there's a wall of thicker hair and then an asymmetrical area of hair loss. So we will compare this to the other side. And over here, we see areas where we're missing, obvious area of missing hairs here. Okay. Very good. So combination, even up here, we see missing follicles here. All right. So this would be a combination of genetic hair thinning as well as areas where the hairs have actually fallen out. All right. That's our first evidence that there's a combination of two types of hair loss going on. And we'll keep going. This is zone 1 and zone 3. Zone 1 and this is zone 3. And they're normally symmetrical because the blood inside our body goes to the right side, the same as the left side. So if it's a genetic condition, you would presume that you're going to see a symmetrical outcome. Does that make sense? Symmetrical, yes, because the bloodstream goes to the left and the right. Okay, great. Now we're going to go to zone 2. All right, zone 2, I'll draw for us. So it's obvious that we've got some thinning in the front. So we can see that there's a lot of baby hairs, but as we go back to the hairline, we see that the hairs back here are thicker. Now we're going to look to see, is there any asymmetry? Okay, so we'll put a line down the center. And the first thing we'll see there is an area, an immune-related hair loss pattern where it looks like the hairs are missing. So these hairs didn't thin out like this hair is thinning out. This hair fell out. So falling out is an immune-related hair loss. So this patient has a combination of the thinning hair and then patches or areas of hair missing all throughout. So this is a combination of genetic and immune-related hair loss. Okay, very good. So this is zone 2. So we've looked at zones 1, 2, and 3 so far. Now there are 5 zones, and this is all the part 1 consult where we review the hair patterns for diagnoses. And if we don't see any evidence of genetic hair loss, we can treat this topically, and we don't need to customize a supplement because it wouldn't be blood related. Since this patient has both, we're going to customize a topical supplement as well as an oral supplement.
Okay. So which is the next one then? We have this.
Okay. This is zone 4 on top of the head. Zone 4 is more of a rectangle.
Okay.
All right. And then zone 2 is in front, and you start to see the same thing, that there's a spot missing right here. So an area of hair loss. Now on top of here, we see also an area here that's asymmetrical to the other side, a little spot here, asymmetry. And all throughout here under the microscope, we saw lots of evidence of missing follicles as well as thinning hair. So if this were just purely genetic hair loss, we would notice what we see here. There's evidence that the hair on the outside edge is thicker, but as we come to the inside, it thins. So thinning pattern for zone 4 thins in this direction. You notice how guys will have hair just around their ears, but it started on top. So the direction of hair loss goes towards the ears, and when it regrows, it comes towards the center line, okay? So we see there's some asymmetry in the areas of missing as well as thinning hair in the very center, okay?
Yep.
All right. Now the next zone is zone 5, right in the back. And we see a little bit, this is zone 5. Okay. And zone 5 starts like a little small something in the center. Think of a dime or a quarter that turns into a peach or a softball. And next thing you know, it's the entire head. So usually guys will come over until it thins out to a point they have no hair to comb over. So it's obvious that the hair loss is a circular pattern. Okay. Now the genetic hair loss that we see, we draw a circle around here, and we're going to notice the hair on the outside circle is better than the circle on the edge on the inside. So this is definitely a thinning pattern. So this edge is thinner, this edge is thicker, this edge is thicker. So this will continue to thin out in this direction. But look how nice and thick this hair is, okay? This hair will eventually grow back through these circles over time until all the hair turns into this hair, okay?
Right.
Now, in the back of our minds, we say, wow, all this thick hair down here, I'm just going to do a quick transplant. Here's how that works. You can put in a few hairs every now and then, but you can't keep up with all of this area of hair that's going to be lost. That's number one. Number two, these hairs are small on the outside, but on the inside, they've got a big root system. So when we do a transplant, we have to make a hole large enough, not for the little small hair strands, but for the underneath follicle. So that's why the hairs are always too far apart in a transplant, okay? Now let's look at this person's hair loss and discern, is this purely genetics that we've seen, or is there also evidence of the immune-related asymmetrical hair missing, hair falling out? So we're going to compare symmetrically this right side to the left side, and you tell me if you see it. Okay.
It
now
looks
it's not
completely
as
different when you
obvious,
stick that line down there.
right? When we first looking at all the hair, you say he's got hair loss, hair thinning, but when you really start comparing, like we do in the office, it's obvious, right? With the green boxes, this is what hair thinning would looks like, and this is an area where hair is missing. So this person has a combination, and if I start looking everywhere, you'll find them. They're all over, okay? But so this is a combination. So if we treated this just with a generic DHT blocker, it's never going to work, okay? This is why we have to first discern the pattern of hair loss to then decide, do you need the topical only, okay? Or do you also need the oral, okay? And then what goes in the oral is based on your blood work, right? You don't know which enzyme is defective because there are 2 or 3 enzymes that could be affected and defected, causing the hormone axis that we reviewed to be out of balance. So all we do inside your body with the oral supplement is to create a balance between the hormone axis so that all the hormone molecules are in their most optimal relationships with one another, okay? So this
And that's why it
patient
has to be personalized, right? Because everyone's different.
That's right. You've got to be personalized. So everyone has the same types of molecules. What differs? The amounts.
Ratios.
Right?
Yeah.
The amounts, right? So everyone has the same types of molecules. No one came from Mars, right? God made everyone, Adam and Eve. And after that, everyone came from Noah. So we all have the same ancestors. But as far as the amounts of molecules are dependent upon your genetics as well as influenced by your nutrition. Okay. So everyone's nutrition is unique to themselves and everyone's genetics is unique to themselves. So this patient thankfully found us and started on a customized topical with ingredients, not just to treat genetic hair loss, but also the immune related hair loss, and as well as a supplement to rebalance his chemistry. Perhaps next week, Tracey, we could go over this patient's blood results, the BRC biochemical report card, because our hunch or our diagnosis going into the blood work is that we're going to see an imbalance of the hormone balance ratio. We would expect to see with this hair loss pattern, we would expect to see the dihydrotestosterone not just being high, but being higher than the free testosterone molecule. So we
Right.
apply the first law of thermodynamics when we treat any patient. And our molecule or our medicine is not a medicine that can do anything harmful to your body. The medicine can only influence the enzymes to regulate the amounts of hormones made, but it's like a seesaw that goes in four directions. You might not
Right.
just go left and right. And today, most people are using finasteride and dutasteride, which is a ingredient or a molecule that causes one direction of flow. And that's where the problem comes in. With a customized solution, we can decide if we want to go left, up, or down based on how we influence the enzymes. So the recommendation is for everyone to get their blood work evaluated and determine if your supplement needs one ingredient, two ingredients, or perhaps more.
Okay. That sounds good. Thank you, doctor. This was very
All right. Well,
insightful.
this has been very hair raising today.
Yes, hopefully we'll be hair raising for this patient.
Yes, absolutely. So hopefully maybe next week or so we'll follow up the blood work for this patient so you can see what this type of hair loss looks like inside the bloodstream. And then
Mhm.
perhaps in a few more months we'll get evidence of the program working, and we'll come back with his before and after just a few months. But we would expect this type of hair loss. It took, I think, about 5-6 years for the patient to really feel like he had enough hair loss to be treated. And my guess is it'll take 2-3 years before it returns. But the goal for our office is to find evidence within 6 to 12 months that it's working, and then simply be patient and let the hair grow in.
Sounds good. Perfect. Thank you so much, doctor. I appreciate it. I'm sure our viewers do. You have a wonderful day.
Trace, if you have some patients that are clients that are calling in
Mhm.
and they're not sure if they want to move forward with a full assessment, perhaps you can offer them just to send in the 5 zones and we could interpret a few and do it even on the channel.
That sounds great. That sounds like an amazing offer. Everyone should take advantage of that.
All right. Thank you very
Perfect.
much.
Thank
God
you.
bless you. Good to see you.